My name is Peter Newton. I'm a pediatric orthopedic surgeon at Rady Children's Hospital.
My name is Burgaze. I'm an orthopedic surgeon at Rady Children's Hospital.
The Harms Study Group is a group of surgeons who get together and collaborate on research and try to solve and create answers for scoliosis. The Harms Study Group started 22 years ago, and this was, again, a group of surgeons getting together, trying to answer questions about the best way to treat scoliosis. And at the time, there were a group that thought it was best to treat scoliosis from the front or the anterior approach, and there was a group that thought it was better to treat it from the back. And those two groups of surgeons had a little bit of a debate and decided that the best way to answer that question was to study it and collect their patients and begin this group to actually do prospective research in scoliosis. And that really was the beginning of the Harms Study Group. It's been going for a long time since, and we've done a lot of other studies beyond that, but that was the genesis.
It's been the Harms Study Group. It's a group that has brought together a lot of, in many cases, like minds, but with very diverse ideas. And it's a really collegial group where it's more than just about it being a profession. It challenges us to do things better, but it challenges us to do things better in a very intellectual way.
One of the real advantages of having so many surgeons participate in the Harms Study Group is that we can understand how they're all doing relative to each other. And that's been a huge advantage, allowing each surgeon to improve their own performance relative to their peers. And I think that's really been an advantage of this prospective data as well. From that, we also can generate best practices. The best performing surgeons in our group in one particular area become the model, and we generate best practices that the others can follow. And that's true for lots of different things that we look at. And it's not always one surgeon that's the best in each of those areas, so everybody has a chance to contribute where they excel relative to their peers and make all of us better.
We all have ideas, and what the study group allows us to do is share those ideas almost as a kind of a think tank. And when we put our ideas in, and the ideas that we get out after coming together as a group it's always better. It's always thought of more clearly. It's more focused, more directed, and in a way helps to ensure that the goals of both the group and the individuals that participates in that group to be more successful in their outcome, whatever that outcome may be.
The research that the Harms Study Group does helps in lots of ways, and one of those ways is to help us understand how to actually put the instrumentation in the patient, what levels and how to do the correction. We've studied lots of different strategies to make that correction the best that we can, and I'm certain that we've done a better job of that. My name is Dr. Peter Newton. I'm president of Setting Scoliosis Straight Foundation. I'd like to thank you for your generous donation. Without these donations, we would not be able to do our research and find a cure for scoliosis.